Tower Hamlets is a really exciting place in which to work. You only need to look out of the window to see the contrast between the office blocks of Canary Wharf and the social housing across the road. Tower Hamlets has a very diverse population. We have increasing numbers of children and young people, many of whom are living in poverty. These are just some of the challenges of working in Tower Hamlets.
I'm the Principal Social Worker for Tower Hamlets Children's Social Care, and I have senior management responsibility for developing and strengthening our social work practice. So what that means is I go out with social workers, I visit with families and children, and I bring the knowledge back from that social work into our senior colleagues, and we help develop our social work inside Tower Hamlets Children's Social Care, of which we have some fantastic environments to work in.
Here at Eva Armsby Family Centre, we've had a lot of feedback from parents and children about why they like the centre, and they've said it because there's a lot of play activities and it's very child friendly. A little boy also told me the other day that he really enjoyed himself in the soft play area.
The Male Perpetrators Initiative was developed because of a gap in our services. The main aim of the programme is to hold men accountable and responsible for their violent and abusive behaviour, as well as increasing the safety of women and children affected by domestic violence. We've developed strong partnerships along the way with organisations like London Probation, and we work in a coordinated way here at the centre with our assessment team and our contact service.
I work as a family centre social worker here at Eva Armsby, and this is one of the typical rooms where we normally conduct our assessments. What I like is an opportunity to work with children and families directly over the period of several weeks, where we get to know the family, get to know their difficulties as well as their strengths, assessing change and helping them to make changes in their lives.
Our aim is to work very closely with our social care colleagues in children's social care in order to improve the educational opportunities of all our looked after children. At Key Stage 2, that's top juniors, for English we were the highest achieving local authority in Greater London, with 64% of our looked after children achieving level 4, which is the national average. For maths, we were the third highest achieving local authority in Greater London.
In the last 3 years, we've developed a young people's group that works with all children over the age of 11. We get them together for an activity day, but we also work with partner organisations to talk about something, say, that's current to the young people, like bullying or raising awareness around gangs in Tower Hamlets.
I'm a personal advisor and I work for the Leaving Care Services. My role is to work through the pathway plan with them and to inspire them to achieve good things by working with them in their pathway plan. We're looking at our young people achieving an independent life.
I've been a member for just under 2 years, and what we do in the Children in Care Council is we get other young people who have invaluable experiences, and together we use this to tell managers how it really is as a young person and what they really need to be changing and what they really need to be doing. And we make it simple, and we get information through questionnaires and such, and we're just all year working.
I'm part of the Integrated Pathways and Support team. We are the very first point of contact. We are a multidisciplinary team, so we have different specialisms within the team, such as we have a housing specialist, we have a health specialist, we also have a no-recourse public funds worker. We also have other specialisms within the team, such as drugs and alcohol and mental health. I find that really helpful because we're all able to access each other's resources and databases, as well as give each other advice and information.
What makes me smile about working for Tower Hamlets, I think, would be my team. Just the laughs that we have in the team, and also having, listening to them. And I'm also very proud of my social workers because their assessments were praised by the inspectors as being robust and having made a difference in children's lives.
The most important aspect of my role in family support and protection is doing direct work with children so that we can elicit their voice and their views, so we can understand their journey and the environment that they're living in. And for example, one of the things we do is we use a form like this, and it's called All About Me. And it's designed by the FSP department to make sure that we can elicit the child's voice and to also make that child feel like a child, you know. And we've got little Oscar here that we also use to make sure we can get their voice and make them feel like children and that they can be heard and that their voice will be listened to.
We're endorsing Professor Munro's view about a whole systems approach to our reforms in child protection practice. What we want is social workers spending more time with families in their front rooms, undertaking social work to understand what's going on, rather than spending time in front of computers.
We want to attract and retain the best and brightest of social workers. We want people who are creative, innovative, who can think independently, work part of a team, who want the best for children and families, who can challenge the systems that often get in the way of good social work practice, who can come with us and drive our vision forward for the future.
Good support from managers. I have a very good team who are very supportive. I have training opportunities. I have the privilege to progress in my career.
It's a fantastic borough, it's a very colourful borough, and it's just great working in Tower Hamlets.